Maybe you've struggled with your weight your entire life. Maybe your periods were always irregular before menopause. Or maybe years ago someone told you you have PCOS or it's just a hormone imbalance. What if the real problem was never explained? Or you've spent years hearing the words, you have a hormone imbalance. I want to ask you one simple question. Has anyone ever checked your fasting insulin? Not your blood sugar, not your hemoglobin A1C, your fasting insulin. Because if the answer is no, you may be missing one of the biggest pieces of the metabolic puzzle. We are getting sicker than ever before. Diseases that were once rare are now becoming common. And the real tragedy is that most people with insulin resistance don't even know they have it. In fact, many have never even heard of insulin resistance. Hi, I'm Dr. Kim, a board-certified naturopathic doctor, and my mission is to help you recognize the symptoms and understand your blood work and know what to do next so you can change your future before diabetes does. Actually, before we go further, this is question 10 for my free 1-minute insulin resistance assessment. Do you have PCOS, irregular periods, or other hormone imbalance symptoms? This applies to all women. If that question hit home, click the link below and take the full assessment. It takes about 1 minute and it will show you exactly where insulin resistance might be showing up for you. Now, let's talk about why this question matters so much. Have you ever wondered? One of the things that has surprised me over the years is how many women have been told what is wrong, but almost no one explains why. You're told your estrogen is too high, your progesterone is too low, your testosterone is elevated, you have PCOS. Those things may all be true, but they're describing what happened. They don't necessarily explain why it happened. Think about the check engine light in your car. The light isn't the problem. It's telling you something underneath the hood needs attention. Hormones work the same way. They're messengers. When something is out of balance, your hormones are often trying to tell you there's a deeper story. Most people think insulin only controls blood sugar, and that's understandable. But insulin does much more than that. Think of insulin as a messenger. It delivers messages all over your body. It talks to your muscles, your liver, your fat cells, and your brain, and yes, your ovaries. So if insulin has been elevated for years, those messages begin affecting many different systems. That's one reason insulin resistance can show up in so many different ways. So now let's talk about PCOS specifically. PCOS stands for polycystic ovarian syndrome, and it affects millions of women. Some have irregular periods. Some have trouble becoming pregnant. Some develop acne. Others notice unwanted facial hair. Some lose the hair on the top of their head. Many struggle with gaining weight around the middle. Many women with PCOS also have insulin resistance, and that may explain why hormonal changes happened in the first place. Here's a simple way to think about it. Imagine your ovaries are listening for instructions. When insulin says stays high for long, one of the messages your ovaries receive is make more testosterone. As testosterone rises, it becomes harder for the ovary to release an egg every month. When ovulation doesn't happen normally, progesterone often drops. Now your cycle becomes irregular. You may miss many periods. You may notice acne. You may notice facial hair. And you may have difficulty becoming pregnant. I'm not saying insulin is the only cause of PCOS. It isn't. PCOS is a complex condition with several contributing factors, but insulin resistance is common enough that I believe it deserves to be part of the conversation. The story goes far beyond PCOS. Now here's something I don't want you to miss. You do not have to have PCOS for insulin to affect your hormones. Over the years, I've seen women who never had a PCOS diagnosis, but still struggle with heavy periods, mood swings, poor sleep, fatigue, stubborn weight gain, acne, thinning hair, and feeling like their bodies are working against them. When we look deeper, many of them had signs of insulin resistance. That doesn't mean insulin was the only cause, but it deserved attention. Think of your hormones like members of a team. When one player isn't doing their job well, everyone else has to compensate. That's what can happen when insulin stays elevated for years. Now let's talk about progesterone. Progesterone is made after you ovulate. If you aren't ovulating regularly, progesterone often drops. Some women notice worse PMS. Others have heavier periods. Some feel more anxious or have trouble sleeping. Now let's talk about estrogen. Hormones work better when they're in balance. If progesterone falls while estrogen continues to have its normal effects, some women begin experiencing breast tenderness, bloating, mood changes, or heavier cycles. Again, this isn't true for every woman, but it's one reason I believe we need to look beyond hormones alone. What about your thyroid? Many women tell me they think everything is caused by their thyroid. Sometimes they're right, but thyroid symptoms and insulin resistance overlap more than many people realize. Both can cause fatigue. Both can make it difficult to lose weight. Both can contribute to hair loss and brain fog. That's why I don't like looking at one body system by itself. Your body is connected. So why does fasting insulin matter? One question I hear all the time is, Dr. Kim, why has nobody ever checked my fasting insulin? The truth is, many healthcare providers are focused on finding disease. I want to find dysfunction before disease develops. Blood sugar can stay normal for years while insulin quietly rises in the background. That's why someone can be told everything looks normal while they still don't feel normal. That's why I believe fasting insulin deserves to be part of the conversation, especially if you're struggling with hormone symptoms, weight gain, or a family history of type 2 diabetes. You know, this is very important to comprehend. We need to develop root cause thinking. Instead of asking, how do we cover up the symptom? I like to ask in my clinical practice, why is this symptom happening? Those are two very different questions. When we understand what's driving the problem, we're in a much better position to make informed decisions about what to do next. So what does root cause thinking actually look like in practice? That's what I want to show you next. The labs I like to see. Now, if you came into my office with hormone symptoms, I wouldn't stop with one blood test. I want to understand the whole picture. First, I'd like to see your fasting insulin and fasting glucose. Together, they help us estimate how sensitive your body is to insulin. Next, I'd look at your cholesterol panel, especially your triglycerides and HDL cholesterol. Those numbers often provide additional clues about metabolic health. I'd also review a complete thyroid panel, not just TSH. Many people are told their thyroid is normal only after one TSH test, when a more complete picture can be helpful. Depending on your symptoms, I may also recommend looking at estrogen, progesterone, testosterone, DHEAS, LH, and FSH. Those hormones together tell us an important story, but I always want to interpret them alongside your metabolic health. Now, people ask, what should I do next? If this video sounds like your story, don't ignore it, but don't panic either. Instead, Become curious. Ask questions. Learn your numbers. Talk with your healthcare provider about whether fasting insulin should be part of your evaluation. If you've struggled with hormone symptoms for years, remember this: normal blood sugar does not automatically mean normal insulin. Sometimes the earliest changes happen long before type 2 diabetes develops. That's why I believe looking earlier gives us better opportunity to make positive changes. Now, I like to give you a message of hope. One of the most rewarding parts of my career has been watching women finally understand what's happening inside their bodies. When women understand the why, they often are more motivated to make lasting lifestyle changes. That being said, every person is different. No outcome is guaranteed, but understanding a root of a problem gives you a better place to begin. If today's video helped you, I'd love for you to take my 1-minute insulin resistance assessment. If you're wondering if this may be you, just click the link in the description below, enter your email, and you'll have immediate access to the assessment. After you've completed the assessment, email me your results and tell me your biggest hormone challenge. I read every email personally, and if you're ready to go further, you can also book a coaching call with me. We'll review your symptoms, your lab results, and discuss practical next steps. If you found this video helpful, please subscribe. You don't want to miss future videos about symptoms, lab work, and practical ways to improve your metabolic health. I'm Dr. Kim, the insulin resistance doctor. I help you find out if you have metabolic disruption before a diagnosis. Know your numbers, change your future.